Okay, welcome back to Introductory Sociology. If you haven't signed in, you want to do that and pick up your quiz from last class. Today we're going to talk about healthcare and the sociological perspectives on this topic. And then next week we're going to watch a film. It's a DVD movie about a documentary about healthcare, and we'll be discussing it. And I think if I check, you'd have to check your syllabus. I think after that we're talking about population and urbanization. And then we have the final exam review and we're all done. We're winding down towards the end of this semester. Healthcare will be the topic for today. It's a big issue in our country, and I was thinking about this. As some of you know, I lived in Japan for a couple of years, and Japan has a pay-or-play system. They have private insurance through employers, and if you don't have it, you can get the government plan. So when I was in Japan, I worked for an employer that didn't offer insurance, so my wife and I had the government plan. It cost us roughly about $200 a month for both of us, but they didn't have any deductibles. We didn't need a referral. So unlike here in the US, even when you have insurance, if something goes wrong, if you get very sick, you'll pay an awful lot. Like when my oldest son had a collapsed lung, even though we have Blue Cross Blue Shield of New Mexico, we paid close to $10,000 because they have family deductibles and so on. So we pay a lot more for health insurance than the rest of the world, and arguably get less. So it's a big issue in our country. We're the only highly developed country that doesn't ensure universal availability in one or two ways. The two ways are socialized medicine, as they have in Canada and the UK, and then the pay-or-play system, as they have in Germany and Japan and probably other countries. So comparing us to the rest of the world, American doctors practice extremely aggressive health care in terms of treating a condition rather than preventing it. There's little incentive. Doctors don't get paid for patients making their patients healthier or keeping them healthier. They get more money when their patients are sick. Unlike we'll see in the documentary, in England, if you're a primary care physician and you can get your patients to be healthier, like low blood pressure, lose weight, stop smoking, things like this, you actually get paid more money. So there's an incentive there for doctors to get their patients healthier, and I mean a financial incentive. Now, the Affordable Health Care Act passed under Obama. The goal was to provide cheaper health insurance and to make it universally available. It created a health care marketplace, basically insurers, private businesses that would offer insurance under the Obama plan. Now, it also had an individual mandate, just like car insurance. If you're driving a car, you are supposed to have at least liability insurance, and if you don't, you can get a ticket, you can get fined for that. And in the same way, Obamacare did that, had an individual mandate. We'll talk about that, but I want to just talk about some points I personally think are good, and most Republicans do as well. And this is one reason why Trump is struggling with overhauling or changing Obamacare, because there are some good points, and we'll talk about these. First, health insurance companies must provide for children's dental care. Adult children can stay on their parents' plan until they're 26, so that will pretty much get you through college. Most people graduate university before that age. So the family plan, you can stay. It used to be once you turned 18, you were kicked off your family plan and had to get insurance yourself. You can't be denied health care based on a pre-existing condition. Or prior to Obamacare, if there was any indication that you had a previous condition, even if it was arguably not true, they could just outright deny you for health insurance. It eliminated maximum payout provisions because it used to be that insurance companies would set a cap of like $50,000, the most they'd pay. And if you got really sick, if you got cancer or needed a surgery, well, for example, my son's total bill with a collapsed lung was about $100,000. Now, of that, we paid about $10,000. But the point is, what's good insurance? What good is having insurance if they're going to cap it on you so that if you got sick, you wouldn't be able to afford to pay for anything? So those are some popular provisions of it. Now, the individual mandate. Under Obamacare, if you decide not to have insurance, you will pay a penalty when you turn in your taxes. When you do your taxes, it's 2.5% of the household income, so that's going to be about $1,200 to $1,500 per family. And so it's often cheaper for poor people to just pay the penalty rather than get insurance. And sometimes they just can't afford it. Since the current average premium for a family is $833 a month. But you've got to have that mandate there. We'll talk about that as we proceed. The problem, though, is Obamacare really hasn't made health insurance affordable. If you look at the research, you look at the studies, people who are under Obamacare are getting less services and paying more for them. They have higher deductibles, higher co-payments, and this has been fairly clear. And a lot of insurers are just pulling out of the plan. They don't want to participate. I think the key thing personally is to make insurance affordable, you've got to control and contain the cost. In Canada, they do that. For example, most medications that you could get, common prescriptions in Canada, are like 90% cheaper than we get in the U.S. And the insurance company, the drug companies, the pharmaceutical companies are still making money. But the way it is in the U.S., until a drug goes generic, which I believe is after 3 years, it can be pretty much whatever they want to charge you for it. Like my oldest son used to take a drug called Keppra, and initially when it was brand name, it was like $17 a pill, and he had to take 2 or 3 every day, and then it went generic. But the point is, in other countries, they put a cap on the amount of profit. So let's say that I'm a company, we develop a new drug, and we can make a profit by selling it at $20 a bottle, but instead we sell it at $100 a bottle. So we're making a huge profit. I think you have to put some rules and regulations on what things can actually cost. Obamacare hasn't solved that problem, though. Now, Donald Trump has said that he wants to keep the ban on pre-existing conditions. So you can get health insurance even if you have a pre-existing condition. He wants to let kids stay on their policies until they're 26, but he intends to get rid of that individual mandate, that you get punished or fined in some way for not having insurance. And here is the problem. If anyone can get health insurance coverage when they get sick, then people won't have an incentive to buy it until they get sick, especially younger people. Imagine this scenario. How many of you young people haven't really needed to go to the doctor in a year? Yeah, so you're basically, you're at your age, you're pretty healthy. Now, if we have a plan, let's say you're older though, say you're 25, whatever, and you're thinking, okay, do I want to have health insurance? Well, since you're basically healthy, if there's no penalty, you would just not have it, and then if something bad happened to you, then you'd sign up for it. And that would cause a collapse of the industry because there aren't any healthy people paying into the spread and risk of the cost. So this is one reason why Trump's initial plan couldn't get by the Republican Congress, because that's the elephant in the room. If you want to ensure everybody has health insurance and you say they can't be denied based on a pre-existing condition, that you're going to run into that problem. It would only be logical. Under that situation, if you could get health insurance anytime you wanted, no matter what your pre-existing condition was, how many of young people would just not have insurance until you needed it? It would be financially a logical decision. So, the healthcare systems in the United States include the services, organizations, and academies and training centers that treat, manage, and prevent disease. Now, healthcare expenditures are about 14% of our gross national product, and they're going up. And 2 reasons why health insurance or health costs are going up. One is we have a lot of research and development. We find new drugs and techniques for treating illnesses, and because it's based on a private economy that isn't capped or managed in any way, they can pretty much charge what they want to charge. Now, insurance companies make arrangements with hospitals to control the cost, but still, when you come up with a new treatment method, a new drug, and we do a lot, it's going to cost more. And second is our aging population. We had a baby boom in 1945 after World War II, so a lot of people were born then. And now, do the math, if you were born in 1945, how old are you? I would say approaching 70, right? Or what? 70? 72? Yeah, so there's and then we have the problem of the rising increase of obesity among Americans generally. And so we have a lot more older people who are having higher medical costs. And I think those two things play into it. Now, only licensed doctors are allowed in the U.S. to diagnose, practice medicine. And of course, we now have nurse practitioners and physician assistants, but those require less training. Most states require at least an associate's for a nursing degree, typically a bachelor's though. And doctors work in hospitals and clinics. Hospitals can range in size from major ones like probably all of you. How many of you have been to UMC, the University Medical Center in Lubbock? Only one? To a couple people. So that's a large facility. You pretty much everything you could possibly need is under that roof. And it could be small clinics like Freona Rural Health Center. It's a much smaller place. So we'll talk a little bit about the various explanations of this from a sociological point of view. First, functionalists would talk about, initially, obviously, medicine and healthcare is functional, it's necessary, so that's beside the point. But they talk about the sick role and how it is that if you're sick, you're allowed to withdraw from your work or school. It's considered appropriate, not lazy or immoral. You can't wish away your sickness, and you're expected to cooperate with medical professionals to try to get better. And to a lesser extent, try to find out what caused your problem. Although if you think about the FaceTime you get with the doctor, typically, you would go to the room, talk to the nurse, the doctor walks in. How long on average do you get with a doctor face-to-face? 5 or 10 minutes. Yeah, and they're often writing a prescription when they're walking out the door. And so now in Japan, when I was in Japan, the doctors, I almost felt like I was getting a lecture because I don't remember, I think it was my eyes or something. I had floaters in my eyes. Not a bad thing, I guess. But anyway, the doctor, he's talking and telling me about how I can lose weight and do all these other things because they're more into prevention. I didn't go there for that. I felt like I'm getting a lecture, but they're concerned about keeping their patients healthy, not just treating the initial condition. And so you'll see in the film how that works as well. Yeah.
If you're sick in Japan, do you have to wear those masks?
That's a good question. The question was, if you're sick in Japan, do you have to wear those white masks? No, but it's very common in a subway or anytime somebody gets a flu or a cold, they're always wearing these masks just to be polite and not spread their. But no, to my knowledge, there's no rule that you have to. But yeah, you see that a lot more. Now, so the sick role, you're supposed to cooperate with medical professionals and try to get better. Now, the conflict perspective would be critical of the medical profession and argue that it's in line with the capitalist and men, and they would say physicians have monopolized the healthcare system and suppressed alternative approaches. Talk a little bit about alternative medicine now. Unlike in Germany or other countries where it's regulated and tested, we have so many alternative remedies out there. Go to the Walmart to the herbs and vitamin aisle. There's all sorts of herbs that say they can do this or that or make you lose weight, but it's not tested, unlike, say, an actual prescription. Yeah, so there's a lot of things out there that just don't work. They're bogus. And now, on the other hand, in Germany, they test things that are considered alternative. Like there's a mist they use for treating asthma. You sniff it basically, and it's was considered alternative, but it pretty much was found to be more effective and replaced shots, the injections that people would get. In the U.S., we sort of throw the baby out with the bathwater. There are some things, I think, that could actually work, but there's probably most of it is quackery. Now, there's a website, I don't have time to go to that, but it's quackwatch.org, and it actually tries to research some of these alternative remedies. So what we're left with is, I think, two things. You have to ask yourself two questions. One, if I do this alternative remedy, is there a chance that it could be seriously harming to my health? I'll give you an example. Back when I had, I tested positive for TB in Japan initially. That's where I got it. My wife and I were helping some homeless people, and they had it. So anyway, I had to take isoniazid for a year and then vitamin B12. And I'm not sure why, but the vitamins I got, I had to cut them. And it got to get the required dose. And so I got tired of cutting these vitamin pills, and I just started popping them, because I think more vitamins, the healthier I'll be. But my fingers started getting numb. I lost feeling, and I went to the doctor, and he said, you're almost, basically there's fat-soluble vitamins. Those are the ones you don't want to take too much of. And then there are water-soluble. Vitamin C, for example. I'm not saying you should, but you could take a lot of vitamin C. It's not going to do you any harm. You'll urinate it out. But the point is about the vitamins is that just taking a bunch of vitamins could in fact be harmful. Or one other example, this will be on video, so I'm not going to mention any names, but I had a friend whose wife had breast cancer. And the doctors said that we can, probably 90%, if we perform a mastectomy, you'll get better, you won't die. But she instead of doing that, she pursued this water therapies, like hot and cold water, and it was really untested. And then the cancer spread, it metastasized, and killed her. And I'm not a woman, but I would assume, what would you if you given that choice, lose your breast or live? I mean,
I would definitely do a mastectomy.
Yeah. And so the point is, though, that there's a risk there. And if you have cancer, there are people who have cancer who do things, alternative remedies that just don't work at all. And second question is it prohibitively expensive? Because we're dealing with things that aren't tested. So if I'm going to if I'm going to try a product or a method or a treatment that is not proven to work, the question is, let's assume it's safe. It's not going to hurt me. But is it prohibitively expensive? Because I'm not going to waste my money on something that isn't proven. I'll give you some examples. Some people say that if you have a wart, if you put duct tape on it long enough, the wart will go away. I don't know that that's true, but you ask yourself, is it prohibitively expensive? No, because it's just duct tape. Is it likely to cause serious harm to you? The worst case scenario is what?
You wrap it too tight.
Or your wart doesn't go away. Or some have said that putting a bar of soap under your sheets will help with restless leg syndrome. So you can ask that question, is it prohibitively expensive? No, it's just a soap. And second, is it likely to cause serious harm? No, the worst scenario is it just doesn't work. Or one other thing, in Japan, they often use this little device about the size of an iPhone, and it gives you electrical shocks, like for sore muscles. I'm not sure. I've tried it actually. I didn't find it particularly effective. But they also use magnets. They're like that are like thin and circular shaped, and then they stick it to various parts of the body. And I've tried that, and that actually helped with sore muscles. And again, and it wasn't expensive. And the worst scenario would be it doesn't work. So those are the things I have. And chiropractic care, there's a whole discussion of that on quackwatch.org. It's not so much the care, but the claim that it can do things that it can't really do. Like my father, for example, had a problem with his neck, and ultimately he needed surgery to fix it. He wasted a lot of money going to the chiropractor, and when he finally went to the surgeon told him, if you would have come to me first, we could have fixed this. You went to chiropractors for 2 years, and they're claiming it's going to help, and it really wasn't. I'm not saying all chiropractors are quacks, but there is some of that goes on where they're trying to treat something by adjusting your spine that really just isn't going to work. Now, So conflict theorists would say that doctors are rewarded because the medical establishment keeps their numbers artificially low, limiting competition among doctors. And in many rural areas, there's a waiting list, not so much a waiting list, but you can't really see your doctor that quickly because they're booked up. And in many rural areas, they don't have specialists. Like in Japan, they're required in all areas to have a trauma surgeon, basically a brain surgeon. Anytime you're involved in a car accident, there's a possibility that you would need to see a trauma surgeon. So in most of the US, we have helicopters called life flights, and in rural areas, if there's something like that, you have to be taken, like typically here I would say, where do you go if you had a bad car accident? Where does the helicopter take you? Lubbock or Albuquerque. Yeah, so so conflict theorists would be critical of this. They would also be critical of the increasing corporate influence over healthcare. This is no longer happening, but after Obamacare reformed it. But before that, many insurance companies would give doctors bonuses for limiting the care they provided and reducing their cost, or limiting referrals. So they would set a target. For example, they'd say, if you can keep your referrals for mammograms under 200 per year, we'll give you a Bermuda Gulf vacation and a $10,000 bonus. And so what you'd see, that referrals would spike in January, because come December, if you're getting close to that cutoff and you're thinking, boy, I don't want to lose my bonus, then you wouldn't refer. Now, if you're insisting for a referral, that you could get it, but many people just aren't bold enough to do that. So they'd be critical of this. Minorities are hit hard because, poor people who have insurance, it used to be called Medicaid, and then it was called Blue Salute, and now I think it's called Blue Centennial here in New Mexico. But basically that kind of insurance, doctors sometimes in offices will say no more Medicaid patients because they don't make enough money from that insurance. And so also what's covered will be different. Like my daughter is adopted, and a long time ago when we were traveling in Oregon, she went into the restroom, an outhouse, it was in rural Oregon, and she fainted. There's a term for this condition. Basically, when you smell something really bad, it can cause a person to faint. Anyway, she hit her head on a rock and was bleeding, and we went to the emergency room, and initially I showed them our insurance cards, and because I handed them Geisinger of Pennsylvania, they wanted to do an MRI, but then when they recognized she was on Medicaid, they said, no, now we don't want to do it because it won't pay. And so you have one insurance that will pay and the other one that won't. And so poor people have this problem, and conflict theorists would be critical of it. They would say that, for example, it used to be prior to the CHIP program, this is the Children's Health Insurance Program, it pretty much guarantees that all children have insurance, either free or at a ridiculously low rate. A lot of people aren't aware of the CHIP program. It applies to children under the age of 18. But prior to that, prior to 96, if you had an ear infection, for example, which children often get, and you went to the doctor, there'd be a sign that says payment must be rendered prior to service. They wouldn't see you unless you paid. And so these kids, their ear infection would get worse to the point of having to go to an emergency room, get a stent in their ear and all sorts of treatment. And it turned out this was a huge money-saving thing because it's cheaper to go to the doctor, get the amoxicillin, and get that ear infection cleared out than to wait until it becomes an emergency. But prior to 96, you would see this going on. So conflict theorists would be critical of this. The symbolic interaction perspective would talk about the socialization process where men and women assume various roles in the medical profession. Medical school socializes students to accept the norms, values, and attitudes associated with the medical profession. To be dispassionate, unemotional. Some people are different, react to this differently. I remember when I cut my leg with a chainsaw, the emergency room doctor was talking about the patient. And I'm here, why don't you just talk about me? And was almost, not robotic, but it was like a mechanic dealing with a car. I know what some other people experienced with that doctor couldn't stand him because he was so, I won't say cold, but he didn't really show any emotions. I liked it because I felt like he knew what he was doing. But I don't know, do you want your doctor to give you a hug and tell you everything's going to be okay, or just treat you more like a auto mechanic treats the car and just be real rational about it. People are different on that. So they learn to be dispassionate about illness, suffering, and death. It's, of course, getting too much emotionally involved with your patients can take a toll on doctors or nurses. Nurses also go through a socialization process. They tend to be white middle-class females. They start out being more altruistic, benevolent, and generous, but upon graduation, they enter a medical bureaucracy that's often frustrating. And some of the bureaucracy, some of the fault is due to lawyers suing. There's and also government rules and regulations, paperwork. It's changed a lot. So nurses often start out being very altruistic, but become a bit jaded or cynical over time, and police officers as well. Part of I'll give you an example. Back when I was a young person in the 1980s, I remember I had a wart, and my doctor, Dr. Flint, just said, okay, well, we'll excise it. There wasn't there wasn't paperwork to sign, we didn't have to go to a hospital, he just did it. But nowadays, there's just a lot more, the medical profession has become more bureaucratic. Now, the symbolic interaction perspective would talk to us about labeling and how it can be applied to illness. People who acquire AIDS may be considered immoral, and so people with disabilities may be expected to act in a certain way. So this issue of a self-fulfilling prophecy, if you believe something is true, then it will become true. I'll give you an example. Back when I had carpal tunnel syndrome due to excavating my backyard, which was a dumb idea, it was good exercise, but the constant banging of the shovel against the hand. So my left hand got better, but the right one I required surgery. Anyway, I remember asking the surgeon, he had a weird name that was kind of, what was his name? But his name was kind of like related to surgery. But anyway, his last name. But anyway, so I did this, and then I said, when can I get back to splitting firewood? Because back in Pennsylvania, I cut a lot of firewood. And he said, whenever you feel like it. And so, I had a bad first day. It was funny because I had Darvocet, and then to take the pain away, and then the kids had the bathroom full of water in the middle of the night. They'd splash from their tub, and so I slipped, and boy, that hurt, hitting my, and then the next day, my wife accidentally took my Darvocet because she thought it was her medicine and was sleeping for 2 days because it's based on the weight of, I'm 300 pounds and she's 94 pounds, so we had a weird time then. Because, she wasn't unconscious, but she was just groggy for days. Anyway, that shows you organize your pills, and if they're old, throw them away. But not everybody does that. But the point is I pretty much. I went back, I would say it was 10 days I tried to split some firewood, and then the stitches came out and then within a couple of weeks I was back to normal. On the other hand, later on, I looked at some of these online forums for people with carpal tunnel, and there's a lot of negativity. There's talk about it's a permanent disability for life, and you'll never be able to do what you did before. And if you go in thinking that, it can become a reality. One example I think that's even more clear is elderly women primarily, who break their hip. Those with dementia have a much better recovery time. Because why do you think that is?
Because they forget their hip's broken?
Yeah, they know it hurts, but they don't really think so much about what exactly is causing the pain. They do better in physical therapy. It's a Yeah, whereas women who don't, they sometimes have this thought or belief that they're going to never get out of the wheelchair, or they always will use a walker, and in fact they do. Yeah.
It's been proven also by psychology. It's not mental and stuff. Like my psychology teacher said that doctors have done studies on people who have not hurt, and then they do surgery or whatever, and they give them like false symptoms, and the patient will come back and report saying that they had those symptoms, and they're starting to realize that it's all mental.
Right. Yeah, there's a lot of our physical problems, there's a certain percent of it that is due to our mind and how we think about our illnesses. And so, it can lead to self-fulfilling prophecies. Now, on the other hand, I'm not suggesting that we take it to the extreme. I mean, if you broke your leg, you don't want to go snow skiing the next day just to try to get better. You have to be realistic and reasonable. But getting rehabilitated and improving, requires that you have a positive attitude about it. So the symbolic interaction perspective, we talk about that. Now, age and health, Americans are living longer now because of better health care and better diet. One of the interesting things, you all are too young to remember this, but when I was a kid, it was very common to see elderly women who were walking over permanently stooped. They had very bad osteoporosis. And nowadays, because we have so much calcium in our diet, our milk is fortified with it. It's when's the last time you saw an older woman who couldn't stand up straight? Not now. You just don't see it. Whereas back when I was a kid, it was more common because I think it was somewhat after World War II that they started. Our diets improved. People are taking more calcium and getting it. Older people. The U.S., though, has the highest infant mortality rate compared to other industrialized nations. Infectious diseases like pneumonia and influenza are the biggest killers of children under 6. Basically, dehydration. If you've ever had a child, anyone have a child? I remember when they're little, you feed them Pedialyte, which tastes like Gatorade without any sugar. It's disgusting. It's like basically kind of a salty. Has anyone ever tried it?
What?
Actually, I've talked to some athletes think it's good, better. For height, it's better. Yeah, better to drink that than Gatorade.
It's fortified. It's got all those
Electrolytes.
yeah.
Yeah. So, but anyway, the kids are dying because of the condition that dehydrates them. Teenagers are at the highest risk for death by suicide, murder, and accidents, especially automobile accidents. And I went to a fairly small high school. I think there was only 600 in the school, but I can think of two during high school. 2 of my classmates that died in car accidents. How many of you had someone in high school that you knew that died in a car accident? Yeah. And so it's a lot of times just risk-taking behavior, just doing stupid things. One time I remember riding with my friends, and we were behind this car in a hill. It was super slow, and you shouldn't pass on a hill, but they kept goading me into it, and I did it. And it turned out okay, but you don't know what's coming down the other side. Older people are less prone to this kind of thing, to doing stupid things like you see on the show, the Jackass show. I saw a clip in a motel, but I'm not going to sit there and watch the whole. Has anyone ever watched the whole show?
I've watched it before.
Yeah. So, does it just involve like pain
Stupidity, like
Yeah.
stupidity.
Pretty much.
causing?
Dumb.
Yeah. So the elderly, on the other hand, tend to die from chronic diseases like heart disease, strokes, and cancer, and a lot of times the treatment can be worse than the cure. Like in my grandmother's case, she had died of multiple myeloma, bone marrow cancer, and at her age, they're not going to do a bone marrow transplant and all of this. She basically just took a lot of this drug called Procrit, which the funny thing was her insurance would only pay for about 30% of what the oncologist recommended. Fortunately, she had a substantial amount of money. She wasn't a millionaire, but she had a lot saved, and so she self-paid, and that allowed her to maintain a good quality of life until the end. So chronic diseases like heart disease, stroke, and cancer. Now, gender and health, women tend to live much longer, but they also tend to visit the doctors more often. So it would appear they're less healthy, but in fact they aren't. It's just that they're more in touch with their bodies and more serious about getting to help when they need it. Whereas men will often die of diseases that, if caught early, could have been corrected. Katie Couric, the news lady, her husband died of colon cancer, and she spoke very bluntly about it. She said the signs were obvious. He had blood in his stools, but he kept saying, "I'm a busy man. I ain't got no time to go to the doctor." And so it got to the point when he did go to the doctor, it was too late. And one interesting thing is married men live longer, primarily because their wives encourage them to go to the doctor before things get worse. So there's this gender kind of a thing that encourages men to engage in dangerous activities or delay going to the doctor. My brother, for example, there he is. This is about a 10-year-old photo. He's a commercial fisherman and runs a tour guide service in Forks, Washington, La Push area. And I remember, this is going back 20 or 30 years ago, he was in Alaska fishing, and he got a jellyfish on his hand, and it caused a staph infection. But the thing is, they have a short season, like I don't know, like 5 days they can fish, and they were making a lot. They were making a killing, and he says, let's just keep on going. When he got to the doctor, the hospital, they were considering amputating his arm, but they put him on IVs and got him better. But see, women are less likely to just go ahead and let that go on, and they're going to get it checked. So this is why the American Cancer Society often hires macho guys to try to convince men that they really need to get checked, as this commercial here shows.
I was just finishing my 199th picture. Never felt better in my life, and I said to myself, when this is finished, I'm going out on my boat. And then I got nagged into going for a medical checkup. They found a spot on the x-rays. It was lung cancer. If I'd waited a few more weeks, I wouldn't be here now. That's me 7 years after surgery, in true grit, because I did myself a favor and got a checkup. So why don't all of you do yourselves a favor? Get a checkup. Talk someone you like into getting a checkup. Nag someone you love into getting a checkup. And while you're at it, send a check to the American Cancer Society, too. It's great to be alive.
Yeah, so the point is that men are often prone to take risks that they really shouldn't, or to not seek medical treatment because it's sort of a macho thing, and this can be a problem. And probably all guys have, looking back on it, did something stupid. I mean, I remember I had a head-on collision in Treasure Lake, Pennsylvania, and my car got totaled, and I put my head into the windshield, and I was unconscious. But then I called my wife. The tow truck took the car, and I said, I need to go to work. I'm going to be late for class. So I drove to the Clearfield campus, which was about 20 miles away. She dropped me off. And then, I did all my lectures, and then I couldn't remember anything I'd done. And so then she said, now you better go to the emergency room. And then I did have a concussion. It was weird, though, because I honestly couldn't remember. But I asked the class later on, I said, was I okay? And I said, well, a little bit fuzzy, but more or less. But the point was, I'm thinking, I can't miss work. I've got to show up. Women are less prone to do those kinds of things. Now, let's see, try the slideshow from here. And also, women are less likely to engage in heavy drinking or driving fast and so on. I mean, if you think about it, guys, how many of you have injured yourself doing something stupid before? I mean, not seriously, but you were just horseplay. You doing so, and so it's very common. Whereas it's less common with women. Now, race and ethnicity, with the exception of Asians, racial minorities tend to have poorer health than the white population. Most of it, though, is due to poverty. People living in poverty have higher rates of infectious diseases from living in unsanitary, overcrowded conditions and poor diet and so forth. So, I mean, there are some racial correlations. Well, obviously, sickle cell anemia is limited primarily to African Americans. And then there's, colon cancer is higher among Koreans, but it's not because they're Koreans. It's more due to their diet. It's any other racial correlations. There aren't that many direct racial correlations. If there's a problem, it's mostly due to poverty. And some of this is just not having the insurance, because if you have insurance, you pay about 3 times less than what you would pay if it was a self-pay thing. Now, dental's different. But what I'm saying is that, like when I had my accident with the chainsaw, I cut my leg, the bill was like more than $3,000 to clean out I had bar and chain oil got in the wound, so they had to clean that out and give stitches and everything. But the bill was like more than $3,000. But then there was a maximum allowable payout by Geisinger, my insurance company, which was like $800 and something. So I had a copay like $35. But the point is, if I didn't have insurance, because the insurance company has a contractual relationship with the hospital, that you pay a lot less. But if say you're a poor migrant worker from Mexico without insurance, you're going to get stuck with a bill 3 times what you would pay than if you had insurance. Now, social class, a big problem here. A large % of the population have no health insurance. So combined with poor housing, poor eating habits, and higher stress, it can become a deadly combination. And one of the interesting things is, what do things cost? If you ask a dentist or an optometrist what it would cost to pay cash out of pocket, they'll tell you right away. But I've done this experiment in various places. When I'm bored at a hospital, I say, how much would it cost if I paid for this myself? And they don't know. They say, well, we have to bill it first. So it's like, would you buy a car if they said, here, you sign the contract, and after that we'll tell you what it cost. So it's very difficult for people without insurance, because like if you need an x-ray or something, you could try this experiment, call around and say, how much would it cost if I paid out of pocket, something simple like to get an x-ray of my hand. They said, well, that depends on your insurance, and we can't tell you. And
I did that because TRICARE will only pay for you if you go on base.
right.
So if you go off base to a doctor off base to get birth control, they don't pay for it. So I called around to see, like, well, what would I pay if I paid myself for this specific type of birth control? And they were like, oh, we can't tell you that.
Yeah.
Like,
Yeah, and I remember asking, my grandmother had a skeletal survey to see what was going on with her multiple myeloma, and I remember, this was a number of years ago, but I asked us, what would it cost if a person just paid for it himself? They have no idea. Sometimes they say, well, call the billing department. That doesn't get me anywhere, because then the billing department says, we can't tell you until we actually submit the bill. So, yeah, it's a difficult thing. Now, hospitals are an important part of our healthcare system. Most babies are born there. It's made childbirth safer and more comfortable now with epidurals available. Assuming you get there in time, and it's possible. But the technology sometimes disconnects physicians from their patients. You lay in the bed and you're hooked up to all sorts of monitors, and you stare at that and wonder what it all means. And there's less contact now directly with nurses and with doctors. So the interaction is reduced, and there's more emphasis on diagnostic machines to give them answers. Now, hospital costs are rising, and patients who don't have insurance, or even those with insurance, there's this issue like, I have insurance and I have a standard deductible. So if I needed an x-ray or something, I don't really care where I go. I'm not going to go find the best deal, but that would actually help reduce cost. But I've got no incentive to do it, right? Because I just go to the closest place or wherever they send me. I don't call. Even if I did call and ask what it would cost, they wouldn't tell me anyway. So there's little reason to do that. And those without insurance have a problem. And so, I remember when I was 18 and I had Guillain-Barré syndrome. Fortunately, it happened when I was 18, so I qualified for Medicaid. And so I was in the hospital, and when you're bored, you got nothing else to do. They send me copies of the bills. And I remember I was drinking cranberry juice. I got into the habit because they said it would help with a urinary tract infection. Cranberry juices were like this big. This was 1986. They were charging like $5 a can in 1986. And then I look at the bill. If they gave me an aspirin, $10 for the aspirin. It's like, who allows this to happen? I understand they have to make a profit, but a can, like a small little 4-inch can of cranberry juice, even today doesn't cost $5. And so, I wasn't paying for it, so I didn't give it much thought, but I found it peculiar. That's one reason, like in Japan or Germany, they cut that out. They're not going to pay, insurance company's not going to pay $5 for a can of cranberry juice and $10 for an aspirin. They're going to allow for profit, but not obscene profits. Now, managed care is an attempt to control the cost. It's a healthcare system based on cost containment and control of medical decisions and treatments. Not all doctors or hospitals accept it. And so this is one of the other funny things. In Japan or Germany, if you are sick, you just go to the hospital where you need to go to. Like, I remember my younger son back when he was little, must have been about 7 or 8, we went to the Apple store in Ohio, and my friend Uba was there, and he was sitting up on this desk playing with the computer, but the desk had a sharp corner, and he slipped, and he got a huge gash on his forehead. So anyway, Uba, my friend from Germany, he was real comforting, and so we're going to the hospital, and we went to 3 hospitals before we found them one that would accept Geisinger, and that was a standard insurance in Pennsylvania. And I remember Uba was saying, like, what kind of country do you live in? Like, what is the problem here? Why can't you just go to a hospital? And the same thing with my oldest son when he broke his nose. We went to 3 places before we found one that accepted the insurance. That doesn't exist in Japan. In fact, in Germany, they consider health care a human right. I'll give you a little story. Back when I lived in Pennsylvania, there was a fellow who worked in the grocery store basically it was kind of like a, what do you call it, where they deliver things. It was a center where they stocked items and trucked them out. So anyway, he got laid off, and then he had a brain tumor. And the doctors in Pittsburgh said, we can operate, we can get this out, we can cure you, but it costs money. And he didn't, it was going to cost like something like $20,000 for the surgery, and he didn't have the money. So the community, Du Bois, Pennsylvania, they had a bake sales at the Catholic Church, and the convenience stores, Sheetz had a coffee can with his picture, and it says, please contribute money. And the community raised that money within a couple of weeks, and he got the surgery, got back, got another job, and he's doing well today, to my knowledge. So anyway, I'm telling Uba, my friend from Germany, about this, and I said, isn't it wonderful how a small town in America can come together and help a fellow when he's down on his luck? And he said, no, that's equivalent to the Nazi death camps. A man's very life depends on people putting quarters into a bucket at the convenience store. He said, that would never happen in my country. He said, it's shocking. Yeah, I mean, he was disgusted with it. But in America, we view healthcare as a market commodity, just like a Lexus. Not everybody can afford a Lexus, and that's okay. Not everybody can afford to get the tumor taken out of their head, and that's okay too. I mean, that's our mentality about it. And so, in a sense, should healthcare be a human right? I'm not talking about getting your nose job or, not cosmetic, but basic healthcare. Yeah. So it's anyway, managed care, some characteristics. Members pay a set fee to have access to medical services called a copay or deductible. If you have an insurance card, on the back it usually will say what your copay is. Quality control is used, standards are set. So, and sometimes these standards may be criticized or be unfair, but they'll say, like, you can get this for this, or like, for example, if you're going to get a prescription, there are rules that govern that. Well, what was it? To get an MRI, you have to be, I don't know, I was told by the walk-in clinic, to get an MRI, you have to get prescribed, I think it was ibuprofen or something beforehand. I'm not sure why you would necessarily, but they'll deny you. The insurance companies will deny the request unless you go through all their hoops. So there are financial incentives for patients to use doctors in their network, and if those are outside the network, it may not be covered at all. Doctors are rewarded for cutting cost and punished for increasing cost. Now, about 75% of Americans are in some kind of a managed healthcare system. HMOs are a system where members pay a fee to have access to services that are typically in a building or complex. So a member could get all their services at one location. You get your blood drawn, you get an x-ray, and so forth. And so, another example about this mentality that's different. My father, I grew up near the Canadian border, and my father loved to go to Canada fishing. And I remember on one occasion, we went to Canada, and he got a triple hook right through his eyebrow. It was nasty, and it's hard to get it out because it's barbed. So we went to the emergency room, and then they took it out, and they stitched him up, and then he said, where do I pay? And they said, what? And he said, well, the money, where do I pay? And he said, we don't do that here. And so then when we came back, he kept calling them to try to pay, and then they finally got rude and yelled, and one of the persons actually cussed at him and says, what the hell are you thinking? Healthcare is a human, and it's not only a human right for Canadians, it's a health, that is, if I'm in Britain or Japan or most of these other countries, well, Japan's different for foreigners, but like if I was in Canada and I was sick, it's a national system, it's for everybody, so you don't pay. Preferred providers, PPOs, are small groups of physicians providing limited services to pre-enrolled patients at a reduced cost. An example of Clovis High School sports physical, did any of you do the $5 physical? Anyway, it's often offered at the high school towards the end of the year for sports. Hospices are a place where people provide support for dying people in a more of a family-like home environment for the terminally ill. And this brings up this issue of euthanasia. A couple of states, Oregon and Washington, have legalized euthanasia, but they have stringent regulations. Basically, you have to have 3 doctors certified 2 things. One, that you have a terminal illness that you're going to die from within a few months, and two, that you have uncontrollable pain. And if you can get through all of those hoops, then they can prescribe a lethal dose of medication that will make you just go to sleep and die peacefully. Studies have found that most of the people in Washington State who apply for the program die before they complete the application process. But there are those who are given this opportunity. And personally, my view about euthanasia is I personally oppose it. But when I saw my grandmother die of cancer, I begin to question, like, is it my right to judge how another person deals with a terminal illness? And of course, the little bit of humor here, what is euthanasia? Well, Ali G is a bit confused about it.
Boom, selector. Check it. Today we're chatting about medical ethics. What is the illness that they give out ganja for?
I believe they've used it for glaucoma.
Where could I catch a disease like that from?
Wait a minute, that's the wrong one. Which one is euthanasia? Which one? Okay, this one.
Let's talk about doctors. Does they have the right to end old people's lives?
That's euthanasia.
Why is it the responsibility of the euthanasia for killing someone else? Surely it's between that patient and the doctor.
Euthanasia is the term that's used when you are killing. It's a nice word for killing.
Well, whatever. You were saying that it's mainly Asian youths that is...
No.
Does you think that they're responsible for this? You don't also agree with him?
Who's responsible for it?
The euthanasia.
I think we're getting confused here. Euthanasia comes from the Greek word for death.
Let me understand what you were saying. You were saying that it got nothing to do with young people in Asia. You were saying that occasionally there's some doctors here who may be from Asia who do this.
That's correct, but they could also be from the United States.
But they're mainly from Asia.
No.
Even
No,
though
no, no,
the
no.
ones that are there behave themselves very well.
No, the Asians,
they have
we
nothing
have
to do with
absolutely no evidence that the Asians do it more than we do.
Anyway, I always find him funny because he's always interviewing intelligent people who don't recognize they're being trolled. Like, he interviewed an astronaut and asked if we would ever go to the sun, and the astronaut said, no, it's much too hot. And then he said, well, what if we were to go in the wintertime? So anyway, it's funny if there's old videos. But anyway, so let me close that. Now, where are we? We're going to have to cut time for time here. Big issue here is how we cover everybody with the insurance. And another issue here is just cost. I mean, if you look at the other countries, we spend a lot more per person on health care than those countries do, and yet we don't get the same benefits as they do. You get better health care in Canada, even though they spend about half of what we do. So how do you cover? Could be a socialized system. Well, we don't know what Trump's going to do, but he's got a real problem, because if he wants to keep those popular provisions of Obamacare, then I don't think it's feasible without some sort of an individual mandate. Now we're going to watch. We don't have time to watch this whole video due to the fact that we're cutting. But I want to show you a little bit about a more serious take on the euthanasia issue.
And then weeknights 10 Eastern. How many people in total did you help die?
It's around 130.
Around?
A little more than 130. Right.
You're not sure of the exact number?
Well, I was helped by a colleague, a psychiatrist, who joined me near the end. The only doctor who offered to join me. In fact, the only doctor who would all cooperate with me.
And the first time you did it, who was the first?
Janet Atkins was the first.
And that was in a van?
In a van.
Why in a van?
I couldn't find a place. I tried nursing homes, churches,
You didn't want to do it at your
hospitals, clinics.
apartment?
No, because the police would raid the apartment, clean it out. And I didn't want to involve anybody else in it, like the landlord.
I mean, what is that like to end somebody's life in a van?
Well, you're not ending the life. I didn't do it to end the life. I did it to end the suffering the patient's going through. The patient's obviously suffering. What's the doctor supposed to do? Turn his back? If he's a coward, he is. But
A lot of doctors do, though.
well, they're cowards. Doctors are cowards, you know that. They won't take anything that's going to hurt their income or their reputation. Anything that possible, any legal thing that's going to possibly be damaging.
I mean, do you have nightmares about it? Did you ever feel...
No. I don't think a doctor should have a nightmare about any medical procedure, or else he's not a doctor.
Did you find it sad?
Well, of course. You don't like to end a life. Look, a doctor, if somebody's got a cancer of the bone, of the hip, you don't take the leg off at the joint, the hip joint, because you want to do it. I says, I'm going to take that leg off. I can't wait to take that leg off. No. The leg has to come off to help save the patient's life. Unfortunately, it entails the loss of a leg.
But a lot of people, as you know, I mean, say, look, you're playing God. That shouldn't
Well,
be...
isn't the doctor who takes a leg off playing God?
You're saying doctors play God all the time.
Of course. Anytime you interfere with a natural process, you're playing God. God determines what happens naturally. That means that when a person's ill, he shouldn't go to a doctor because he's asking for interference with God's will. But of course, patients can't think that way. They want to live as long as possible and not suffer. So they call a doctor to help them end the suffering.
Are you a religious man?
No,
Do you believe in God?
I don't know. Is there a God? Look, I'm a scientist. A doctor is always a scientist.
Do you fear death?
Well, as much as anybody else. I fear it only because I like living so much because I feel good.
If you were ill, if you had a terminal illness and were in pain, would you take your own life?
If it was unending pain and there's no cure, of course. I'm doing this for me. See, it's my natural right. That's in the Constitution, in the Ninth Amendment, which is ignored. I have a natural right to do whatever I want with my body. Anything. As long as it doesn't affect anybody else or any other property, and I give permission, myself permission to do it. That's true of anything. I help a patient only with his permission to do what I think is necessary, and it's all laid out in detail to the patient.
Do you think you've had an impact? Do you think you've been successful?
I think this film may have an impact because it's very emotional and very powerful. But it helps the issue, and that's what counts. Whether it helps me or not is irrelevant. And I like that because it helps the issue.
You use different ways of ending people's lives.
Yes.
At first, what did you use?
I had to devise a way to do it. The patient was quadriplegic who wanted a doctor to come and help him die. I says, look, I can help you, but it's illegal. So I've got to find a way to do it legally. And I'll get back in touch with you. And in the meantime, I was working on a way to do it.
So you basically just came up with an idea in your
That's
mind
right.
to make a machine.
That would save me from having to do it.
So a machine that would allow the person to actually end
That's
their
right.
own
I
life.
would set up the machine, all the solutions and everything, and the intravenous line, and then the patient would hit a switch and start everything flowing.
Later on, you started using a gas,
Yeah, because they took away my license for the controlled substance.
so you couldn't get access
No,
to...
so they made it harder for me and harder for the patient. But that didn't bother them. They don't care about the patient suffering.
We're going to have to stop there due to the time constraints, but one thing I want to point out for purposes of the final exam, there's a difference between passive euthanasia and active euthanasia. Passive euthanasia has always been legal. It's basically pulling the plug, refusing medical treatment. Let's say you're terminally ill with cancer and it got to the point where you're just about ready to die. You can just say, stop providing me treatment, let nature take its course. Active euthanasia is where the doctor does something intentional to immediately result in the death of the patient, like giving him an intravenous injection. I don't know. What are your opinions on that? Should doctors be allowed to assist a terminally ill patient in ending his life?
Well, if the person wants to, then yeah, because he's suffering.
I have a really low pain tolerance, so if I would like that, I would totally take the pill and take
Yeah.
me out.
But what about? There's the religious position that it's basically suicide. Anyone think that?
Well,
I mean,
if the
person's
doctor's
suffering.
okay with it and the patient, I don't think it's anybody else's
And the
business.
person's gonna die and he doesn't want to suffer, so.
Yeah. Yeah, so it's a controversial issue, and now with older people living longer, there's not only the question of euthanasia, but how much treatment is sometimes treatment is worse than the problem itself. That is, here's one example, like my grandmother. She was just too old and frail for a bone marrow transplant. It was just not, I mean, and doing it to her would have just been inflicted more suffering on her than she already had. So what's the quality of life issues? When considering treatment, you have to consider the quality of life. Will this make this person happier, better, and feel better, or is it just going to be worse than the problem they have right at the moment? So yeah, those are some of the debates and that go on now with elderly people. I mean, and my father, he once said, my father loves to fish. He said, if I ever had a terminal illness, I go out on the Nooksack River, and he fishes on logs sometimes. He balances, and he said, I'll just fall off and drown. He said, I'd rather die with a fish, with a fish at the end of my line than wither away in a nursing home. And so, I mean, he's still active. He's 80 years old, but I mean, he has seen people who ended up in the nursing home with a terminal illness, and I mean, his perspective is, I'd rather die fishing with a salmon on the end of my line. So, different perspectives on it. All right, so we're going to go ahead now and review for the quiz. First off, you need to know that the gender thing. Men appear to be healthier because they go to the doctor less often than women. But the explanation is, it's a gender thing. Men are socialized to try to be tough and to think that they don't need to go to the doctor. And to some extent, going to the doctor, I'm not saying it's a feminizing experience, but it used to be for no apparent reason. They make you take your clothes off and wear this little pink gown that's hard to tie in the back and sit up on a high perch. And actually, a doctor in Du Bois, it was really weird. He only accepted male patients, and he had hunting trophies, and he had a Great Dane that walked around. He tried to make it a man cave, because what he found is when he had a practice that was overtly masculine, that guys were more prone to go to the doctor than the doctor that makes you wear that little pink gown that does hardly ties in the back. And I mean, so not to excuse guys, but the thing is that a lot of guys, especially working class guys, they think it's tough and manly to avoid the doctor, when in fact it really is not. All right, so healthcare among the poor, we said that it's because of poverty and poor diet. It's not just that they don't have access to health care. Their poverty creates other problems like poor diet, poor living conditions. So the point is, it would be a good thing to give health care to poor people, but it's not the only solution to their problems. Okay, we didn't talk about this. I must have bypassed it, but let's talk about this now. Mentally ill people have the lower classes have higher rates of mental illness. There are two reasons for this. One is that being lower class is stressful, and stress can lead to mental illness. And the other one is becoming mentally ill can make you poor. Anyone guess how that could happen?
Pay a lot of money.
Yeah, it's hard to work, hard to function. You may lose your job. I mean, my mother has bipolar that's fairly well managed, but when she's had episodes that were manic episodes, there's no way she could hold a job. She was just too silly, and so the point is, sometimes mental illness can make it difficult to work. Okay, a hospice, you need to know what that is. A hospice is a physical building, a location where terminally ill patients go to die, and it's more of like a family home environment where you can visit, and it's not so much like a hospital filling. There's also something called home hospice. Some terminally ill patients just go to their home and they get oxygen and treatment and pain meds, and then they die in their home. Okay, euthanasia, an argument in favor of it, well, is that, not to say I'm agreeing with it, but the Kevorkian's claim is that it's your body, and you have a right to do with your body whatever you want as long as it doesn't hurt other people or damage property. That's one argument. And of course, the more obvious argument is like the amount of pain is that, we're not animals, but I remember as a young person, my dog Woof, he was 13 years old and he was just so sick, and it was sad, but we had to put him to sleep. But looking back on it, the amount of suffering he was going through, it was probably for the better. And so we're compassionate to our pets, but in some cases, with human beings, they're just going through a lot of suffering, and arguably, well, what is the point of that? I mean, so those are some of the arguments. I'm going to go ahead and pass out the quiz, and when you're done, you can bring it up, and we'll see you guys back Tuesday. We'll be watching film.